Hey there, my name is Seth. I was a third-year med student once. I struggled with shelf exams. Decided to make some test-taking strategy changes. Things went a lot better after I did that, so I've been teaching these techniques for a little while now. I'd like to share them with you and help you out with your shelf exams. This is part one. I'm sure I'm going to have several parts, lots of different ideas of how to approach teaching this concept. Lots more coming in the future, but for now, let's just talk about shelf exam in general. I remember my first email of getting a failed shelf exam, and the word fail just lingers with you for a long time. You've made it to your third year. You're excited to be at the clinical stage, and here you are failing, and it's frustrating, and it's depressing, and it was one of the tougher things I faced in med school, honestly. So I'm here to help you with that. And honestly, being corny, if I can do it, so can you. It's the corniest thing I could think of to say, but really, it's true, and I do want to help you guys. First thing to think about with any shelf exam is the timing and the environment. So if timing is an issue for you, timing is an issue for me, so I've got some ways to approach that. What about the environment? Where are you taking this exam? Are you taking it at school? Is it 1 o'clock in the afternoon? Because for me, those were terrible places to be taking a standardized test, but that's what you're faced with. I'm a very extroverted person, and I found that being extremely introvert on test days, I don't talk to anybody. I didn't hang out with anybody beforehand. I just stayed in my lane and kept to myself, and that set me up for success. And the same thing with focus. You meet up with your old friends and you're all having a good time, and honestly, it just doesn't contribute to success on test day. Like, you really need to stay in the zone, especially for a 1 p.m. test, which is unusual for quite a bit of us for medical school. The test is 110 questions. It's 2 hours, 45 minutes. Okay, so the math is really simple if you break it down. I do one time through. I don't take any breaks. I don't go to the bathroom. But the math is simple. 15 minutes, and you get 10 questions for each of those 15 minutes. It's easy to keep track of this. So you should be starting question 11 when you have 2 hours and 30 minutes left. So there's a clock on the top corner. Question 21, I need to be starting that with 2 hours, 15 minutes left. 31 at 2 hours, that kind of thing. That keeps my pace. That keeps me honest for time throughout the duration of the test. I don't get behind. Mandatory is using a mouse. I have several reasons for this. I'm going to show you guys how to do some aggressive highlighting. So get yourself a wireless mouse. Seriously, don't go anywhere without your mouse. You want to practice questions the same way you're taking the real test. So get yourself a mouse and keep it with you. Let's talk about what you see in clinic versus what you're going to see on shelf. The long story short here is that the clinic is going to have some gray areas. The test has to be black and white. Okay, so you're going to see patients in clinic that, based on a textbook, they don't have that disease, or based on a textbook, they do have that disease, but they don't actually have that disease. You're going to see some gray area. On these tests, it's black and white. Don't fool yourself. Well, I saw a patient one time with X, Y, and Z, and it didn't turn out to be that way. That's too subjective. They can't test that way. Everything that they test has to be objective. And the way they build these questions, they build them in reverse. They start with an answer choice that's the correct answer, and they work backwards from that. They say, okay, what's going to be similar to this answer? Okay, what's going to distract them? Okay, let's give them a narrative that explains that answer, but let's throw in some other stuff to distract away from it. So clinic has gray areas. These test questions, they're black and white. So anemia is anemia. I had an internal med physician ask me if a patient in the hospital was anemic. So I looked at the labs, and I saw that the hemoglobin was low, but I knew this patient had been in the hospital for a little while, and they've gotten fluids, and I'm honestly just thinking that it's hemodilution. I'm not real worried about it. So I was super smart, and I said, no, they're not anemic. And he looked at me like I was crazy, and he said, anemia is anemia. If the patient has anemia, call it anemia. Is it microcytic? Is it normocytic? Is it macrocytic? Just because you say that this patient has anemia doesn't mean you're going to treat it. But for the sake of being objective for these test questions, anemia is anemia, and you move on. Call it what it is. Other things like signs and symptoms. So a test question gives you something like bowel sounds and says bowel sounds are not present. Okay, well, there's a very certain list of diagnoses that will show up on a test as bowel sounds not present. Things like ischemic bowel and upper GI obstruction. Versus a hyperactive bowel, that's going to be a lower GI obstruction. So you can already see like upper versus lower GI. If you see hyperactive as part of the question stem, don't fool yourself. Don't get distracted. Start to think really, truly algorithmically. So I'll go into that a little bit. Some of the other objective data that you're going to encounter on this test are things like rash distributions, lab values. I'll show you how to use lab values to your advantage. The secret is pretty much everything on these exams is objective. They don't need your subjectivity. They don't need you to get creative and come up with some wild reason as to why this disease is presenting in this new, unstudied way. That's not what they need. That's not what they're testing. Keep everything objective. Flowcharts. You've all seen them. I threw a few on here. Honestly, I didn't even look through them, so don't use them to study. But here's a foreign body in the airway type flowchart. Here's the infamous hyponatremia. This one actually is pretty helpful. I haven't looked through this specific image, but you need to know, like, are they euvolemic? Are they hypovolemic? That changes your treatment course for hyponatremia. It also changes what you think is the problem. I've used this flowchart quite a bit, determining, do we need to do a fast exam? Do we need to get them to the OR immediately? Do we need a chest x-ray? Thinking algorithmically. Everyone's familiar with the ACLS algorithm. You get to a certain decision point, yes or no, make your decision, and you follow that part of the chart. Here's one for thyroid. Again, these are just to kind of reinstate the idea that when you see a sign or a symptom, what that's doing, it's moving you down an algorithm. It's getting you a little bit closer to an answer. So the core idea for thinking algorithmically is understanding that for every single disease process, there's an etiology, a pathology, there are symptoms. Diagnosis, how do we confirm the diagnosis for this disease process? Is it imaging? Is it a lab value? Complications, okay, if we don't treat this, what happens? What are we worried about? And last but not least, treatment. This is always in a stepwise fashion. Obviously, you're starting out with conservative treatments, and there's many examples for this, but we'll get into more later question types. But almost all questions stem from these core ideas right here. They might give you symptoms, and they're asking for treatment. So you've got to take these symptoms and convert it into a diagnosis. And then you have to know, okay, what is the treatment regimen for that? What's the first step in treating this disease? Or they might give you a diagnostic study, and then they might ask you what the pathology behind this disease is. So again, you've got this diagnostic study. Oh, that's how we diagnose disease X. Okay, what's the pathology for that disease? This is where everything's stemming from. The reason this is important, if a question pops up and you recognize the symptoms and you get the disease process correct, you knew that part. What I missed was the treatment. Man, I nailed. I knew that it was multiple sclerosis. I totally missed, what the first line treatment was for multiple sclerosis. In your notes, do not study the diagnosis or what the symptoms of multiple sclerosis look like. For you, in that question, you need to study what's the treatment for multiple sclerosis. You become more efficient in how you're doing these questions, how you're studying. Tackling a question. How do we go in a stepwise fashion through every single question? Again, when you get questions wrong, you've got to know at which step of the process did I get this wrong? What information did I miss? What did I not read? Hold yourself accountable for every single step. It's just like going through an EKG. There's a stepwise fashion to it. If you tackle every question the same every time, you can coach yourself through what you did wrong and start fixing some of the mistakes. First thing you're going to do is you're going to read the question, not the stem, just the question. That gets you in the ballpark, okay? Now we'll just go through these briefly and then I'll explain them. Then you're going to classify the answer choices. What even are we dealing with? What area of medicine? Then you look at any imaging that you might have. Then you look at labs. Then you look at the last couple lines, kind of see, if anything's popping out. At that point, you finally read the prompt and highlight, and then you start ruling answer choices in and out. So we're going to walk through each one of these individually. Importantly, educated guessing, acute versus chronic. A lot of the times the question will give you a time frame that this new chief complaint has been around. If they've been taking lisinopril for 30 years and they've got this new cough for a week, maybe it's not the lisinopril. And then process. If you are just absolutely lost as to what's going on, so if you've got all sorts of different answer choices, and one of them is an antibiotic, and based on the question stem, you're really thinking that this is probably an infectious process, maybe go with the antibiotic. So starting off, read the question. This is the last line of the stem. This will be the most frequently asked question. What is the next best step? Now, when I started taking these tests and answering these questions, I thought that this was asking, hey, student Dr. Bernard, what's your opinion on the matter? Taking all things into consideration, what do you really think is the best thing to do here? Super wrong. Totally terrible way to go about it. What this is asking is, you remember on that previous page, treatment is one of the fingerlings of each disease. They are literally asking step 1, 2, 3, 4, whatever of each disease process. Where are we in the treatment process? A lot of the times they'll tell you, hey, we tried step 1, this patient didn't respond. So all they're asking is, what's the next line of treatment? What's step number 2? That's all they're asking you. Once you've got your diagnosis and you figured out that, hey, we tried step number 1 for treatment previously, step number 2 is all they're asking. That's all they're asking you. There's no subjectivity here needed whatsoever. So base this purely on treatment regimen and indications. What's the diagnosis? That one is a lot more straightforward. And you know that, okay, I'm going to have to read this stem, and I know kind of what bias I'm going to need to read it on because I'm going to look at the answer choices. Which of the following is caused by this medication? So this is a great one, because a lot of the times you read that, you look in the previous sentence, it says something lisinopril, and in the answer choices you see cough. You might already have the answer to this question, and you haven't spent the precious seconds reading the stem. Now I'll state again, I'm a slow test taker. I use every second on these exams, so time for me is important. All right, so after we read this question and we know, all right, what am I trying to figure out? You read the answer choices. Is it 5 antibiotics? Is it procedures? Sometimes you'll get lucky and it's ethics answers. The reason that's important is they'll give you this long stem about some traumatic event, and this patient had this type of surgery and had these subsequent diagnoses, and they take them back to the OR, and you're sitting here trying to work through all the types of shock that they've been in and out of. And turns out it's a question about living will. You're just figuring out what you're dealing with. What information do I need to set these apart? So when you look at these answer choices, you might see 5 cardiac medications, okay? And it says, which of the following is the best next step? Okay, so based on these 5 cardiac drugs, I really need to know what disease we're dealing with, but I need to know heart rate, I need to know blood pressure. I'm not going to give a contraindicated drug in those scenarios. That's when you start ruling things in and out. So by looking at the answer choices and seeing, oh, hey, it's 5 drugs. Okay, how do I determine which one of these will be the right answer? Just by asking questions about these answer choices. That's important because here in a second you're going to read the stem, and that's when you are going to glean the information that you need to differentiate these answer choices. It's a different way to think about it than just reading the question and answering it. It's an objective, tactical approach. Third, you look at the imaging. Sometimes it's super obvious. You might have a mid-humerus fracture, and oh, hey, I remember that's the radial nerve, and you see radial nerve as an answer, and voila. Sometimes it's really simple. Next, we look at labs. Labs are key. Labs can be your best friend. You have to go through labs every single time. You'll get faster at it. You'll get better. It becomes easier. Labs are objective. They might be the most objective thing on the test. You can't argue against labs and vital signs, but labs especially. Okay? You and your new mouse are going to highlight every single abnormal lab. Low is low, high is high. If the potassium is 1/10 of a point too low, you highlight it. Reason being, yes, it's hypokalemia. Are we going to treat it? Not necessarily. What a lab value at that, like, well, it's questionably low. It's really not that low. I'm not sure I'd treat it. That tells me that there's another red flag somewhere on this page. And usually if you go looking, you'll find it. Same thing with blood pressure. If you're not sure whether or not it's hypotension, it's 104/72. It's kind of borderline. When they want to give you a patient with hypotension, it's going to be 80/50. Back to labs, highlight every single abnormal lab. Low is low, high is high. If you don't know the normal range for the lab, absolutely right now, look it up. You have to use the resource that's on the page. It's free points if you are looking it up and keeping track of it. You'll get faster at recognizing what normal is. You'll get faster at looking them up. I can't tell you how many times I got burned on stuff like albumin and creatinine for some reason, especially albumin, trying to tell me, what the status of this person's liver is, and I just would totally miss it. So always look that stuff up. It's free points. Highest yield labs, I'd say sodium, potassium, glucose, of course, white blood cell counts, and H&H. White blood cell count is really telling you, yes, there's an infectious process, or no, there's not. Glucose, hypo versus hyperglycemia. Potassium, typically cardiac. And sodium, that massive flow chart that we saw earlier. Pro tip, one of my students taught me last year, if it's high, they'd highlight the value. So they might highlight the value over here on the right. If the value is low, they highlight the name over here on the left. The last couple lines. Once in a while, this will give you a really big buzzword or clue as to what's going on. It might be trachea deviated to the left side. Well, that's a very few specific amount of things. Patients diagnosed with multiple sclerosis. The stem is going to give me this long, convoluted story about her neurologic symptoms, and then at the very end, they're going to tell me the diagnosis is MS. What do you want to do about it? So it'll save you some time. It'll save you some time reading. Or, the mother states the infant tolerates honey. And sometimes it's nothing. Sometimes it says physical exam and vitals are negative and benign, and there's no helpful information, which in its own way might be helpful. All right, so next we're into reading the prompt and highlighting. This is your most powerful tool in all of test taking, and the reason being, it's black and white. It's binary. Our new thought process is objective. Things either are or are not indicated or suggested by this stem, by this question. Highlighting is you telling future you here in about 20 or 30 seconds, this is important, this is what it is. If you're highlighting a vital sign because it's low, you're telling yourself here in just a moment, this patient's hypotensive. Blood pressure 70/30. You cannot forget that. Use the highlighting to tell yourself what is and is not important, and don't second guess that. You have to highlight all abnormals, unless it's like an ethics question or it's just purely not pertinent to the question at hand, which is not often, but we'll go through questions and do some examples of that. But highlighting all abnormals. Patient has shortness of breath. Always highlight the chief complaint. Sometimes age is important. Duration is important. What other signs and symptoms do they have? Vital signs, things like that. Highlight all pertinent normals. So if your patient's coming in, they have lungs, clear to auscultation, but the chief complaint is shortness of breath, that's pointing you in the direction of a very few things. It's probably not asthma or pneumonia. I'm thinking more like PE. Is there a chest pain associated? You start formulating more questions on your own. But again, you're highlighting those pertinent normals. So if one of the answer choices is pneumonia or bronchitis with clear lungs to auscultation, this isn't clinic. There's no gray area. I'm sticking with my guns. Highlight strange info. So I don't always highlight meds, but if I've looked at the answer choices beforehand and they all look like side effects, I might be highlighting the medications. You're using the highlighting to help remove all the subjectivity from your decision making. So we're trying not to be subjective here. We're trying to be objective. Highlighting is objective. Highlighting abnormals is objective. Highlighting pertinent normals is objective. You're telling yourself a story and you're building this presentation for the answer. What do you think the answer is at this point? And why is it those things and why is it not those things? Rule in and rule out based on information you've come across. Okay, I saw that the patient was hypotensive at 70/40. I'm not going to discharge him home. I'm going to get rid of that one. Okay, I see that this patient has a fever. Maybe they have pneumonia after all. They're post-op patient, or they just gave birth, or whatever other inciting event is taking place, and they've got this fever and this tachycardia. I'm concerned. If the patient has no fever and is normotensive and has a regular heart rate and rhythm, I'm probably not thinking sepsis. So you're ruling yourself in and out based on what you've highlighted, what you've looked at in the question. Review your highlights, put the big picture together. Again, normotensive, no fever, it's probably not sepsis. Go with what you know. So that's part one of what we're going to talk about. Next, I'll go into doing some questions. We'll do some questions together, start to deconstruct how this stuff is built. Please share this with your friends, share this with your colleagues. Thank you for watching. See you guys next time.